I definitely understand some of what the MOC is trying to do. You really want to make sure that we're really up to date. We know with the current patient treatment, and I understand that. And I want to do the best for what's for my patient as well. However, the thing is, if they are going to do this, we want to make sure that there's data to support, all the recommendation that they were asking us to do.
There's so many requirements now that they're adding to everything where it's kind of infringing on our ability to, maintain a practice, maintain our day-to-day routine. So I think, those are some of the issues, aside from many others, probably.
Well, very important because it's going to affect me for the rest of my career, and I think there's a lot of good points in debate that's occurred to really make things more cardio-centric or cardiology-centric as far as keeping up to date, as opposed to needing to do maintenance of certification that really isn't relevant to our field or practice. So we have enough demands placed on our time as it is.
I have been to the Dr. Tierstein's website and followed that before, and there's some YouTube videos talking about it, and of course we get all the emails, and there are even articles in New England Journal and ACC, and Jack and everything. So you're reading articles about it. They're out there. It's easy to follow. There's enough people wanting to tell you about it.
Since we're still in training, I think a lot of the fellows don't necessarily think of so much right now with the maintenance of certification, because we already actually, in continuous education. I do think it's necessary for us to maintain our certification in a manner that really kind of everybody should stay up to date and continue to be educated. But the way that it has to be done a little bit of different manner. I agree.
We don't have much of a salary, so there's a lot of constraints in that regard. It's the only exception where, irrespective of you being a fellow, you're expected to pay the same that an attending who makes 5, 6, 7, 8 times your salary. Whereas, if we're attending ACC conferences or any of the conferences, the stipulation that you're a fellow really distinguishes you, and it's recognized that your salary is not on the same level. But the ABIM doesn't recognize that.
The business of medicine is something that we don't get taught much going into all this, and I've been learning the last couple of years myself, trying to get more accustomed with it, and it's a challenge.
Rather than 10-year exam recertification, I think the best approach would be just continuous assessment, that updated knowledge, and through online process rather than taking the exam every 10 years. You have to go through a whole process of preparation. Anyway, it's good to refresh your fellowship times.
I would like to see what the Tierstein group, the alternative, might have to offer. I would like to see, I would like there to be some competition. I would like to see if hospital will be also accepting, certification from the ABIM, but also from the other organization that's going to certify.
I think for us as fellows, we're open to ideas, but also would like other people to hear what we think is best.